on anisakiasis. So what is anisakiasis? Anisakiasis, or herring worm disease, is a parasitic disease caused by nematodes that attach to the wall of the esophagus, stomach, or intestine. The best way to prevent this disease is to avoid eating raw or undercooked fish or squid. The most common fish that anisakiasis is found in is salmon. One may ask, how does one become infected? When infected marine mammals defecate into the sea, eggs are released into the water and develop into infected larvae. Crustaceans consume the larvae, which are ultimately consumed by fish or squid. Humans swallow nematode larvae when they eat raw or undercooked contaminated fish or squid, so the larvae can infect the gastrointestinal tract once inside the human body. The parasite eventually dies, leaving an inflammatory lump in the esophagus, stomach, or intestine. I'd like to explain the chart here a little bit better. So imagine a host, pictured here is the dolphin, which is infected by the parasite. So mating takes place and eggs are released into the water through the dolphin's feces. So an egg will hatch and turn into a larvae, which will then be eaten by a small crustacean. The crustacean will then be eaten by a small group of fish or squid, which then contaminates them. And if you think about it, fishermen like to fish on the biggest fish that they can find. The heavier the fish, the more money they make off of it. So the larger groups of fish will then eat the smaller groups that were contaminated and become infected themselves. This becomes an issue for the definitive host. Here, the dolphin. But for us, it would be us humans who will then eat those larger fish and can become contaminated. After or while eating raw or undercooked fish, some people report a tingling sensation. This is actually the worm wiggling around in your mouth or throat. These people can frequently manually take out the worm from their mouth or cough it up. This then prevents infection. Also, vomiting is a symptom for some people, and this might help to eliminate the worm from the body. What are the symptoms of anisakiasis? The main signs and symptoms include abdominal pain, nausea, vomiting, abdominal distension, diarrhea, blood and mucus and stool, and mild fever. Some individuals may even experience allergic reactions where rash and itching may occur. Additionally, and in some infrequent cases, anaphylaxis can also occur. How is anisakiasis diagnosed and treated? It is usually diagnosed by detecting a 2-centimeter long larva in the intestines during an endoscopy, radiography, or during surgery if the worm has embedded. As far as treatment goes, most patients improve spontaneously without specific therapy, but if necessary, the worm can be removed by endoscopy or surgery. Also, in some situations, prescribed medication can be effective if surgery is not necessary. It is also important to note that the risk of contracting anisakiasis is low, and the disease is quite rare, but it is quite common in areas where eating raw fish is popular, such as Japan. Since eating undercooked fish is becoming more common, some cases have been seen in the United States, Europe, South America, and other areas of the world. What is the prevention for anisakiasis? As mentioned before, and ultimately, the best way to prevent infection is to avoid eating raw or undercooked fish or squid. Another method would be to follow the FDA's recommendations for seafood preparation and storage in order to kill parasites. The FDA recommends cooking all seafood, in general, to an internal temperature of at least 145 degrees Fahrenheit or 63 degrees Celsius. For storage, the FDA recommends freezing fish at one of these 3 ways. The first way is to freeze at -4 degrees Fahrenheit, which is -20 degrees Celsius, or below for 7 days, and that is the total time. The second way is to freeze at -31 degrees Fahrenheit, which is -35 degrees Celsius, or below until solid, and store at -31 degrees Fahrenheit which is negative 35 degrees Celsius, or below for 15 hours. The third way is to freeze at negative 31 degrees Fahrenheit, which is negative 35 degrees Celsius, or below, until solid, and storing at negative 4 degrees Fahrenheit, which is negative 20 degrees Celsius, or below for 24 hours. Any of these methods will ensure that the parasites are killed.